As the pandemic enters its second year, Pew Research Center now reports about a fifth of the U.S. adults, that is, are experiencing high levels of psychological distress. The National Eating Disorders Association helpline also has experienced a 40% jump in overall call volume since March 2020. And now many Americans are anxious about what returning to work might look like. So with May being Mental Health Awareness Month, let's take this conversation to our virtual roundtable. Clinical psychologist Dr. Ali Mattu, eating disorder therapist Ashley McCann, and director at the University of Connecticut Health Disparities Institute, Dr. Wisdom Peril, are all with us today. Thank you all for being here. Dr. Mattu, I'll start with you. Employment has been a major stressor during this pandemic. A lot of people lost their jobs. Others are now starting to head back to the office after working from home for a while. What's your advice on how to handle work-related stressors right now?
Yeah, it's a really difficult time, Diane, and I would say one of the things we all need to do is take things one step at a time. We're all returning to a very different world than the one we were in before, so practicing how to navigate the steps to re-enter the world in whatever situation it might be for you, taking it one step at a time, finding ways to communicate the powerful emotions that you might be experiencing, and getting very comfortable asking for help. What this pandemic has shown is none of us can get through it by ourselves. We all need the support of a community. So finding ways to reach out for help in whatever way you can right now is probably the biggest mental health tip I would have for everyone watching.
And Dr. Powell, we've seen people of color disproportionately affected by this pandemic, but mental health services and mental health issues, they also tend to be more stigmatized in communities of color. So how do you combat the stigma that comes with admitting you need help, especially in communities of color?
Thank you for that question, Diane. I think it's important to level set, though, that we are a nation that struggles mightily with mental health stigma, and that we have a culture of emotion suppression that pervades our nation, and it impacts how we seek help, how we talk about our emotional lives, and that's not something that's just unique to Black, Indigenous, and people of color. But at the same time, there are significant stigmas around mental health in those communities that are related to a lot of previous experience with health systems that have not necessarily treated those people with respect, dignity, and granted them access to quality care. So I think that overcoming the stigma has to be a national effort, and one that's not just focused on those communities of color, but that really elevate the need in our nation to pay attention to our mental health. We need, in this nation, mental health parity, which would actually legislatively send a signal that we're all in this together, and that asking for help for mental health problems is not something that one should be ashamed of.
And Ashley, let's talk about the intersection between mental health and physical health in the isolation of the pandemic. A lot of people turn to all kinds of things for comfort and just to get them through the day. And some of those things weren't great for them. You've mentioned that people with no previous food issues developed them during the pandemic. Can you explain that a little more?
Across the country, people have been taken out of their normal daily structure and stability, and the isolation has increased our mental health issues across the board. So we're seeing this with people who already had diagnosable eating disorders, and now people who have been stuck at home in isolation with environmental triggers, with mental and emotional triggers. People are seeking what they can. And with the limitations of not being able to leave the house or get back into their typical healthy coping strategies, more people are likely to fall back on what's at arm's reach.
And Dr. Mattu, children, the little ones have had just such a hard time, really, during this pandemic. There's some silver linings, right? We get to spend more time with them. I've got some little ones, but it's clear that remote learning has affected their socialization. It's just hard for them to stare at those little Zoom squares. So how worried should parents be about this? And what will it take to help kids, get on what you might call a more normal track?
Yeah, it's a great point, Terry. And it's been a really difficult time for kids, especially for younger elementary school kids, where it is more developmentally normal to have concerns about germs and hand washing. And we know for middle schoolers, a big way in which they learn is through peer interaction and through socialization. The good news here is most of our kids are are going to be resilient. They're going to bounce back. They might have struggles learning how to get back into the school routine. Most of them are going to be okay. What I'm concerned about are the kids who haven't had the equal access to technology, to internet bandwidth, who might also have learning disorders that have made it very difficult, or whose parents have been lost jobs or have been experiencing their own stressors. So the important thing to remember here for parents is there's a lot we've learned. Most of the kids are going to be okay. And if you notice that your child is struggling more than what their peers might be, that's a time to look for help. What I have been encouraging all families to do is help your child stay connected to one good friend. That's what we all need, children and adults, at least a connection to one good friend.
And Ashley, the New York Times also reports that eating disorders in teens have exploded in the pandemic. You say that sometimes things that we do to try to help can actually make things worse. So what are some of the do's and don'ts here if this is happening to your kid or a loved one?
You know, whenever this happens to anyone that you care about, the best thing that you can do is to look to them for how you can support them, help them connect to care as soon as possible, never to wait. When you have someone get into treatment at an earlier point, there are better outcomes across the board in research. So access support, get a professional involved, seek treatment in a treatment center, start to address it, take it seriously, never question it.
And Dr. Powell, let's talk about that for people who are struggling. Where does mental health treatment stand, access to it, and what should people do?
So first of all, we don't have enough access to mental health services in our country to meet the needs and demands of the population. That's a huge problem. But there are opportunities to access those services at community health centers, through your primary care physician, and through organizations like NAMI and others that are providing boots on the ground support for people. The important thing is to get the help you need and to recognize that it's okay if you're feeling distressed. It's actually probably normative given the prolonged periods of physical distancing and isolation that we've all been experiencing.
All right, Dr. Ali Mattu, Ashley McCann, Dr. Wisdom Powell, we appreciate your time today. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.